Newsflash. You can't. You can't look frozen.
Mine was super tight last time. I was really, really pulling.
I have a patient at one time ask me to slim her calves with Botox.
I remember that.
Which, I mean, honestly, like, I would just give it up.
I've thought about it.
Biggest mistake, I mean, I feel like is overdoing the forehead.
Why, from the nose up, do you want to look 40, and then from the nose down, you're okay with looking 60?
Like, it's got to be more than just Botox. That does not erase everything. I mean,
you might get a bruise from Botox. I'm sorry.
You might.
It is a needle penetrating your skin.
Welcome to Fill and Tell, where we spill the tea on all things aesthetics.
We're your hosts. I'm Megan.
And I'm Lauren.
We're here to give you the inside scoop on what goes on behind the treatment room door.
From filler to facelifts, skincare to aesthetic secrets.
We're taking you behind the scenes of the industry with unfiltered conversations, expert insights, and maybe a little gossip along the way.
Okay, today we're going to talk about Botox myths, mistakes, must-knows. I think this is a great topic for everybody who is new to Botox. Maybe you're seasoned to Botox and you kind of just want to learn a little bit more. We're going to cover and break down all of the things that we think that patients should be aware of. Maybe some different neurotoxins and
maybe getting our husbands/boyfriends on board.
Yeah, so that you don't look 20 years older than him.
Yes. Like, can he at least wear sunscreen?
Right. So we're going to jump straight into Botox mistakes.
Yeah. Myths.
Let's
do myths.
Let's do myths
Let's
first.
do some
Okay.
myths.
So Botox myths.
So easy one. It freezes your whole face.
Right. Very common myth that we hear from patients, right? I think a big thing when they come in to see us are like, I don't want to look frozen. I don't want to look frozen.
/ fake. I don't want to look fake. I don't want to look fake.
So, newsflash. You can't. You can't look frozen.
The only
right?
time I feel that people look frozen is when they like have bad plastic surgery.
Yes.
Like your Botox isn't going to make you look frozen, you know?
Wait, have you seen the movie? Is it Just Go With It or Just Go With It? It's Adam Sandler. You're not a movie girl. Adam Sandler.
She called me out.
Jennifer Aniston, and he's a plastic surgeon. Have you seen that movie? Oh man. Okay, we'll show the clip of the guy who's at the party. He's taking him to this plastic surgery, and this guy is like literally frozen, has water coming out of his mouth, like can't swallow. And he's like, dude, you need to lay off. He's like, I can only feel like right here.
That's
You gotta stop, though. I'm telling you. Did you have any feeling in your face?
Just in this one spot right here. And then from the eyebrows down, dead.
That is frozen.
Yes, that is frozen.
But that is because of plastic surgery.
Yes.
So really, it's hard. You can look weird with Botox. Don't get me wrong, right? Like you can get a funky eyebrow. You can get, you've had this, I've had this, a lot of tightness in the lower face.
Yes.
And that can look off and weird.
But not frozen. Yeah.
So I think that is a big myth. You can't
I think
really
the word
look
frozen came about just because if you explain to a patient that we're going to stop their muscle movement,
right?
Then they immediately are like, wow, well, if I can't move any of my muscles, I'm just going to look like this frozen weirdo.
Yeah.
Which it just isn't the case. We've seen so many times our beautiful patients who have these beautiful smiles, they still have their genuine smile. They just have less lines.
Right.
That's it. That's all
and
it is.
The dose is obviously super customizable.
Yeah,
so
exactly.
it can move as little or as much as you want it to.
Yeah. I mean, like, I think a perfect example is when you and I get Botox, you just have your anatomy, you're able to move your eyebrows a little bit. I think that's just the spread of the Botox in your forehead. Whereas me, if I want not a lot of lines, my forehead is smaller. Like, I don't really get much. Well, I have movement now, so don't pay attention. But I get the little lift. It's just my anatomy. And so it is what it is.
Okay, next myth. Biggest, like, this is a big one too, and I don't know why people are so obsessed with it, is once you start it, you can never stop.
I know.
I don't know who put that out there in the world and then into the internet, but it's like, I know it's chaining you up and bringing you in here every 3 months.
Well, and here's a a positive news flash. If you do get Botox, say for a year, and then you get pregnant, if you stop, you'll look much better than when you
even before you started,
because of the decrease in those harsh muscle movement lines that you're starting to get.
That was an interesting phenomenon that happened during COVID, right? Is because so many people who were getting Botox for 5-10 years and then had to stop during COVID, those people looked exponentially better because no, they weren't getting it, but like those lines, those static, deep etched in lines were not coming back.
Exactly.
So you can absolutely stop. You're not going to look worse. You're going to go back to just as you started, potentially better.
Probably better.
Probably
better, especially if you've been being consistent for a few years. I mean, those deep lines that you once had here aren't going to be there anymore. Yeah. And I know this is off topic, but that goes for filler too. Like if you stopped filler, your face isn't going to just melt away.
Right.
You'll just eventually probably go back to normal.
Yeah. Next one is what?
Only for wrinkles. Botox is only for wrinkles.
So many different uses.
Yeah, and fun fact, Botox Cosmetic has 16 FDA.
Is it 16
now?
now? Yeah.
So there's 4 for aesthetic purposes, forehead, glabella, crow's, platysma, and then 12 for therapeutic.
Yeah, originally started for a medical problem, which was a blepharospasm or like eye twitching.
That was back in 2002. It's been around so long.
Yeah. So it's not only for wrinkles and cosmetics. We use it in our office to treat TMJ, jaw clenching, jaw pain, sweating.
Yes, sweating's a big one.
Especially now that it's about to be summer. Some trap, neck tension.
Neck pain.
Or it can get a little swan neckish if you want a thin neck. That's so funny when you say like thin neck there, because I did have a patient at one time ask me to slim her calves with Botox.
I remember that.
That one cracked me up, and I was just like, I'm gonna go with no. Like maybe I could, but I'm just gonna go with like this seems a little too far away from like my comfort zone. We're gonna go with you're gonna keep your calf muscles.
There's also cool things that Botox can do, like decreased oil production. It can help with pores when we do just little blebs all over the face. It can help with the necklines here.
My husband has actually used it before during surgery.
Has he?
So a plastic surgeon in town that he will work with sometimes, if somebody tears their pec muscle, right? Like, I'm not sure how it happens, but they could tear their pec muscle and they have to repair it. So they will Botox the muscle so that it's not contracting
and moving
while it's healing from the repair.
That's really cool.
I know.
I mean, yes, and people use it for bladder spasms.
Yeah.
Like, I think that this medicine is so cool. And if you really do a little bit of research, you'll quickly realize that there's so many properties and positives about it.
And then it works instantly. That's another myth. I don't hear it as often, but there's sometimes when people will come in and they have a wedding in 2 days and they want it to work right away. And I was like, maybe we could pick a certain product to get you a little bit kicked in. But it's definitely not an instantaneous drug. You do have to wait that unfortunate time period.
Like 2 to 3 weeks.
2 to 3 weeks. That's normally when we see patients back for a touch-up or, to make any small little tweaks or just to make sure you're happy. So it does take that full amount of time. I love getting the messages from people one weekend being like, oh my gosh, something's not right. And I'm like, well, I get it. It's
give it
okay.
time.
We got to give it another week. And I would say 9 times out of 10, it's all resolved.
Always. I mean, when Lauren's Botox is kicking in, because I see her every day, all day, I'm like, I could just see little things where she looks a little different.
Yeah.
Her eyes get a little bit wide, and she, when her lip flip is kicking in, So, but it's going to take, we used to do our rechecks at 2 weeks. We actually pushed them out to 3 because even then we were still seeing some changes. Yeah.
And then you at that point, you really have to, you can't be touching it up after that. Yeah. Because now we're introducing toxin too quickly and it, then we have a resistance issue. So 2 to 3 weeks to come in for any sort of touch-ups and stuff like that.
Yeah, and then so that sort of leads into the last myth, which is all Botox is the same.
Yeah.
Because some Botox brands, like let's just say, Botox is an umbrella term.
Yes.
Botox Cosmetica is a brand of neurotoxin.
Correct.
There's other neurotoxins, Dysport, Daxxify, Xeomin, Jeuveau, And Botox.
And Lativo.
And, okay, Lativo is now in the U.S. market.
Yes, and there's a couple, like, that are still coming, I think, in the next year or two.
So is MyoBlock in the U.S.?
Yeah.
Or, okay.
It is.
I mean, because Erica's using it, but, like...
I don't put it in that kind of
category.
subset.
Because it's different.
Yeah, it is a little bit different. They use it for resistance type patients. I think MyoBlock originally was maybe for cervical like stuff, but now they use it for more resistance type patients, and it's not great. Like if you're truly resistant, you can use that product, and I think you only get like a month longevity.
Oh, wow.
Which is better than the people who are actually resistant, meaning nothing works.
Yeah.
You inject it 2 weeks later, you look the same.
Yeah.
Nothing works. Those people are happy with a month. Which, I mean, honestly, like, I would just give it up.
I've thought about it because...
You're not resistant, though. You just metabolize it quicker.
Yeah.
But that's not resistant because yours kicks in and it looks good for a short period of time. But that's not resistant. You do not need MyoBlock.
Yeah. So, like, the idea behind the different brands and sticking to one brand is you hope to not ever develop resistance.
Right.
And so...
But honestly, like... I'm in the fridge when it's time for me to get neurotoxin. I'm like, what is available?
Yeah.
I used like 3 different products on myself this time.
I know.
That's probably a no-no, but...
We wouldn't do that to a patient.
No.
Sometimes we'll do Dysport up top and then Botox in the lower
low,
face.
Yeah.
We've, in particular, have seen in ourselves that Dysport can be pretty tight in the lower face.
Yeah.
I do think that there's some patients that can handle it.
Mm-hmm.
Mine was super tight last time. I was really, really pulling. So
You were. And brands are just going to be different for everybody. I think you have to kind of find what works for you and then just kind of stick to that one.
Yeah, stick to that one until...
I'd always describe it to patients like, what do you prefer, Coke or Pepsi?
Yeah.
I think that's a really big difference, but similar, right?
So especially with Botox and Dysport, I do
Yes.
feel like those are the most popular, and
I feel
that's
like
what I
you
say
are like
too.
You are like in one camp or the other
Yeah.
sometimes, like
Yeah.
diehards
Yes.
for either.
Yeah.
Okay, let's get into some
Mistakes. In Botox?
mistakes. Yeah, so mistakes from patients, mistakes from injectors. Biggest mistake, I mean, I feel like is overdoing the forehead.
Yeah, I mean, that can easily make a patient go from looking fine to looking really bad,
Yeah.
looking unnatural. I mean, when you drop someone's eyebrows down here.
I know.
Really, I do think that the forehead is a skilled area. It takes a skilled injector.
Which is so funny because it's one of the first areas that you learn to treat, but I think
it's
it
so
remains
tricky.
the hardest.
We've actually had so much experience with people that have excess skin here or just need a brow lift because our patient population is 50s. It's getting younger. You know, we're getting up some of our 30s and our 40s, but a lot of our patients for a while were late 40s, 50s, and naturally your anatomy has your eyes down and lax. And so in order, like, I could either say, okay, none of these patients can have forehead Botox, or I can figure out how to treat their forehead.
Right.
And that's just what you have to do. You have to go to a good provider who can explain the trade-off.
And who can tailor treatment.
Yeah.
You know, because if you're just injecting in a certain pattern, just doesn't work for everybody.
Right.
And
Not
you have
everyone's uniform.
Right. You have to treat the other areas around the forehead as well. So treating the 11 lines, treating the crow's feet to really offset and balance everything out so that everything is not kind of pushing down.
Yes, we always encourage people to do their entire upper face. And then really, when you get into your 40s, we encourage you to do your lower face. Because why, from the nose up, do you want to look 40, and then from the nose down, you're okay with looking 60?
I don't know.
Why don't we treat the lower face like we treat the upper face?
And a lot of, I think a lot of our patients now at this point are certainly subscribing to that kind of message. And they all do want to look more uniform and like youthful all the way down.
Yes.
And then I think the next mistake really from a patient perspective is wanting complete like instant results from Botox alone. And it's such a gateway drug to get into the office, right? It's quick, it's easy, you're in, you're out. But there's so much more that has to be done in order for you to have that kind of holistic look.
Yes.
And that kind of completely natural look. It's got to be more than just Botox. That does not erase everything.
Well, right. And that sort of brings up the topic that we try to explain to all of our patients is good home skincare is so important for the longevity of your results, for your Botox to look 10 times better than how it would look just alone.
Right.
I don't see the point of investing in Botox if you're not taking care of anything else.
No.
It's sort of like going to the gym but getting McDonald's on the way home.
I mean, guilty sometimes, but yeah. I mean, I totally get it. And we were just talking about weight loss medications and the easy, like, I think they're fantastic. I think they're great. They are solving a lot of issues in the world, but the quick fix, I just want 30 pounds gone and I don't want to do anything. I just want it to happen. You know, that's just not of the same mindset, I don't think. So coming in to just have Botox for everything to be fixed is just not going to be it. If you're still laying out in the sun, if you're smoking, if you have
going
a terrible
to the tanning
lifestyle.
bed. My patient yesterday came in for her Botox and looked at a different race. And I was like,
So
ma'am, you need to not go in the tanning bed.
Yeah, because
she's like, I'm not anymore, Megan. My membership is running out.
I think all tanning bed salons should be shut down. I don't even know how they exist.
How are they still running?
I don't know who is going.
Like, we know that they cause skin cancer.
Yes.
Also, it doesn't look good when you look like leather.
No.
Okay.
We already, we already like really went down.
Yeah. Anyways.
Okay, chasing every little line too. So
this is really hard for me with my patients. I've referenced that a lot of our patients are 50s and beyond. And so naturally they have a saggier lid. They have excess skin. And so they want a brow lift, but then they also want all of these lines gone here and then, you know, everything to be smooth. There is a trade-off, and that's just education with your patients, but I'm sure you get the exact same thing.
Or it's like you do one thing and they come back in and they're so now hyper-focused on the line that was already there, but you had so many other lines to begin with. So now you're only focused on that one. And I'm like, okay, well, and again, in order to treat all those tiny little lines, we have to be doing other things. Microneedling, lasers, skincare. You got to go all in if you want all the lines gone.
Like so there's so many layers of the face, and we're treating the muscle.
Right.
But you're not treating the skin on top of it. You're not treating the bone loss. You're not treating the fat loss. So I had a patient, this isn't Botox related. She was actually really happy with her Botox. Probably my favorite cheek filler I've ever done in my career. And there was just this little area that she felt was bigger than the other area, and she has an asymmetry in her face already, and so I specifically put a little bit more filler on that side that has the flatter asymmetry. I had to dissolve it out.
You did?
I didn't dissolve out all of her cheek filler. You know, at the end of the day, I think it's hard for us too, because we see professionally how great she looks, but she just felt like there was just this one thing off about her cheek. And it's okay. I'm going to do what's also going to make her happy within reason. It's not like it was unsafe.
Right.
We did a little bit. She thanked me. She was really happy.
Well, good.
Yeah, after. But
a win-win then.
Yes. It's just, I felt like we were sort of chasing this very little thing. But if that little thing makes her happy and then that's good, then we're good.
Yeah.
You know.
And then I think the last big mistake you can make is really just shopping around. And we, really talked about that a ton when we were talking about, red flags to look out for in injectors. But you really have to be, if somebody is offering $7 Botox, it's a red flag.
Yes.
It's not a good deal. It's a red flag. $11, a good deal, right? It's a special. Go ahead. They're running a special on, you can get however many units for this price. Bank them.
Right.
$7 though, just
that could be counterfeit Botox. We had a few cases back in 2024 that people were hospitalized. Yeah. So this is where Botox gets a bad rap, because people were hospitalized from Botox. It was literally not Botox.
Right.
Who knows what they were being injected with out of China. So
you do not. Right. You can get a bad infection. You can get all kinds of stuff. You're definitely going to get some resistance.
Yeah.
And just,
and also
if it's too good to be true, then it
probably is. And also just a caveat on that, when people come to us from other offices and they're like, well, I treated my upper face for $300. Our price is higher probably than them, but also the way that we dose is going to be much different than your $200 range. So, just doing your research. If you go to that med spa, let those trusted professionals coach you through it, and you'll probably have a great outcome.
Yeah. And then finally, some hot takes, which we covered some of these already, but some hot takes, some must-knows to take away from the episode, which is skincare and your consistency, right? Yeah. We just said that. Don't waste your money on Botox if you're not going to do some skincare, period.
And also, how do you feel about this? Don't waste your money on Botox if you only do it once a year.
Yeah. I mean, I'm like maybe twice a year. Though,
you're twice, though.
You know?
But when okay, this is actually for people who truly need it every 3 to 4 months to soften those deep set lines.
Yeah.
If you don't have any deep set lines, you could go a year without getting it and you would be fine. But it's our patients that come to us who like have been sun worshipers or just didn't take care of their skin and they're sort of just not on a good regimen.
Right.
They actually surprise me and they're willing to get skincare but it's the consistency and the skincare consistency at home.
Right.
That
And then,
will make the big difference.
and that goes back to, again, must know it doesn't erase every other poor lifestyle choice that you have made.
Yes.
So your smoking, your tanning bed exposure, your poor diet, your lack of sunscreen. Yeah. It does not erase everything.
You still have to do all those things.
No.
And you'd be surprised. Your Botox will probably last longer and look better.
Yeah. And it's time to get your boyfriends and your husbands into the office.
You've done Botox
Brian,
on
I
Brian.
know. And some filler and a laser.
But that was probably 2 years ago.
I know. Poor thing. He hasn't been back in a year.
One time he came into the office and I was like, hey, BC. And he's like, hey, Megan. He was so sad to be there. He knew what was about to happen.
He's not happy when he comes in.
Lauren's like, sit in the chair.
He will come in because he broke his jaw. And so we'll do some like Botox to help his jaw pain. And then while he's there, I'm like, okay, I've got you now. Yeah. And I can like do everything else. Yeah. So I just have to be really quick because he's got about a 10-minute tolerance.
He also does not have a good pain tolerance.
No. I mean, they're men. They're weenies.
I feel like Zach's pain tolerance was okay when we were doing the BBL. Yes. Because he didn't have numbing on. I've done Botox on Zach once. He has his crow's feet are cute at this point, but like they won't be cute in 20 years.
It's going to be like, okay, you didn't watch White Lotus either. This is not fun when you don't watch anything.
I need your login.
Okay.
I want to watch it.
I'll give it to you. So on White Lotus though, and then, the memes blew up on Instagram and she's like, why are you with this middle-aged man? Does he have a lot of money?
That's going to be me
and that's going to be all of us in this room when all of our husbands look 20 years older than we do.
Yeah, I'm going to still be looking 30. And Zach, with his no sunscreen because he thinks it's toxic and no Botox, is going to be looking 50.
Exactly.
He's lucky because he looks young.
Well, he is.
But he's not. He looks younger for his age, is what I mean.
And then this is a fun fact, too. Botox can actually improve depression.
Yes.
I think that was a very interesting study that came out that people's perceived, emotion like went up. Yes. Their mood increased when they got this area treated. So those 11 lines, that really kind of just angry look at rest, when that was treated with Botox, their perception of happiness like actually improved quite a bit.
Yeah, I think it was called the facial feedback hypothesis.
Oh, was it?
So basically when
did you come up with that?
I looked at the study.
Oh, okay.
No, it was called the facial feedback hypothesis in this study, and basically what the hypothesis was that if they can't always do this because they're always mad or sad, then it improves their mood. Yeah. I just think that's amazing.
I know. That's awesome.
Yeah.
And then a quick little like what to do before and after.
Yeah.
Right? So I think this is a good one because people literally freak when they get a bruise. I mean,
you might get a bruise from Botox. I'm sorry. Might. It is a needle penetrating your skin. Right. We do everything in our power truly to like avoid that. But filler is a different story, but
avoid alcohol the night before, the day of. Avoid anti-inflammatories, fish oils, things like that a couple of weeks before if you're really trying to be cautious.
Yeah.
Actually, it showed like if you have caffeine the day of.
Really?
I mean, I'm going to still have coffee.
all of our patients.
Exactly.
And then things to avoid after. I always tell my patients not to put any pressure to the area. So like wearing a hat, going and sort of laying on your face right away.
Yeah.
But you can wash your face like normal that night.
Right.
You can do your skincare. You can sleep however you sleep. I'm a stomach sleeper. So there's no way I'm sleeping like this.
Right. But avoid like hot yoga, saunas, exercise for that first 24 hours. And then you're pretty much in the clear after that. You can't mess it up after that point.
You really are. Sometimes we'll have people avoid like facial massages for a week.
Yes. Yeah.
But realistically, if you give it 24 hours, you're probably good to go.
Yeah. So that was fun. That wraps everything up there. So some good takeaways, myths, mistakes, must-knows.
Botox.
Yes. If you have questions, please leave them in the comments. If we didn't cover something or if you really want to know something, then please ask us. Make sure you like and subscribe to the YouTube and follow us on Instagram.
Yes.
Send us some DMs and let us know what you want to hear next.
Yes.
Until next time. Bye, guys.